Hello, hello, hello. How's everybody doing? You know me. It's Dr. Melva. Welcome to the broadcast. Welcome to the live broadcast. All right, we are broadcasting live. I'm Dr. Melva, and today is Thursday, August the 31st. Thursday, August the 31st. I'm broadcasting live from North Carolina today. Still in the clinic, making sure my background is HIPAA compliant. See my little view. I'll tell you more about those trees a little later. Welcome, welcome, welcome. Woo! How's everybody doing today? Today we are going to be talking about 3 tips to handle a poor care experience. Uh-oh. That was my booty on the phone. Let me not move too much. All right, 3 tips for handling a poor care experience. Welcome to the broadcast. Thanks for joining, Dawn. How you doing today? Welcome to the broadcast. All right, so we are broadcasting live from North Carolina today. I'm Dr. Melva. Thank you so much for joining the live broadcast. If you're catching me on the replay, thank you so much for watching. For those of you just joining my live broadcast, I'm Dr. Melva, and I help people that have been diagnosed with cancer through my videos, speaking programs, and community cancer centers. I help them to navigate the cancer care system, transform their lives, and live in spite of cancer. All right, so today we were talking about 3 tips for a poor care experience. Hold on, I need to figure out where I'm going to stand. Hold on. Let me just get my life together here for a second. It's been a long day. How's everybody doing today? All right, so I just see that there. Hello. Welcome to the live broadcast. It's Dr. Melva, and today we are talking about 3 tips to deal with poor care experiences. And I'm also trying to get the light. Welcome to the broadcast. All right. I am checking things out. All right. Hey, Dawn. Thank you so much for joining. Welcome to the broadcast. All right. So, okay, let's get going. All right. So I'm Dr. Melva. And as you can see, if there's a close-up, I'm coming to you with red eyes. Red eyes represent me being up and working hard all day. I've been going since about 5 this morning. I'm still in the office at 6:30 Eastern. Shout out to all my doctors who are working hard, taking care of our patients. Sometimes you have red eyes. Sometimes you're away from your families, and I respect and salute you for that. But there comes a time when you cannot allow physician burnout to get into the way of you and patient care. The last 2 weeks, I have heard and listened to within systems that I'm working in and systems that I'm not working in, patients who have had poor care experiences. Whether that's poor care experiences defined as being with their physician, their nurse practitioner, their physician's assistant, office staff. Hello. Hi, Michelle. Thank you so much for joining. Today we're talking about 3 tips to deal with poor care experiences. So I was sharing that I have had multiple stories, multiple experiences from patients, friends, family members talking about poor care experiences. So when you have a poor care experience, that's what I'm going to call it, when things are going right, what do you do? Okay? What do you do? So it takes all that I have to listen to the situation, unbiased and supportive without making any negative comments. It takes everything that I have, and I'm being real with you today, okay? And I listen, and I want to be as open as possible because 1, I wasn't there for the situation. 2, I have no idea what was going on, all the circumstances. And 3, I should be professional, right? Right. So with that said, though, the encouragement that I give to you and that I give to all my patients when I hear about a horrible care experience. Hey, Dr. Yvette, thank you so much for joining the live broadcast. We're talking about 3 tips to deal with poor care experiences. So when I hear about a poor care experience, what I recommend to my patients and what I'll recommend to you are to do these 3 things. Number 1, the most important thing that you need to make sure that you do is to make sure that your medical needs are met. Okay? So when you find yourself getting poor care, and you know what poor care means. Poor care means when the physician or, mid-level provider, whoever walks into the room, they don't greet you, they don't ask you what's going on with you, they say statements that upset and hurt your family, they're disrespectful, they're short, you're waiting a long time. You understand what poor care experience is, right? I hope everybody's following me. Welcome to the broadcast, Dr. Lakeisha. Thank you so much for joining. Welcome to the broadcast. So when you have a poor care experience, number 1 thing that you need to do is make sure that your medical needs are met. Okay, and we do that by acknowledging that the situation is just gone bad, right? But without blowing off too much smoke so that you don't get your medical needs addressed. This is difficult to do. It's difficult to do. I'm going to admit, because even on the side of a patient advocate as a radiation oncologist, listening to my patients, especially those who have been diagnosed with cancer, what they deal with and what they're told by hospital staff or physicians or any touch of the medical system. Welcome to the broadcast. Welcome to the broadcast. It's very difficult even for me to listen. But when you're in that situation, your goal are to get your medical needs met. Okay? So we can deal with the situation and how we can improve that situation after your medical needs are met. Okay? So that should be your focus. Welcome to the broadcast. Welcome to the broadcast. We're talking about 3 ways to handle poor care experiences, because in the last 2 weeks, I've had multiple patients, families in and out of the systems that I work, tell me about uncoordinated poor care experience. And I don't like to talk about negative things a lot, but we need to address it and need to make sure that, number 1, your medical needs are being met. Okay, number 2, and this doesn't have to happen at the visit. Welcome to the broadcast. Welcome to the broadcast. Thanks for joining. Number 2 is that you have a right. You have the right, you and your family. Sorry, that light behind me is just bugging me. Okay. You have a right to a patient advocate. Some systems have, I may be pronouncing this wrong, but an ombudsman. Is that how you pronounce it? Somebody help me out. But you have a patient advocate, patient advisory, and there is a standard procedure where you can discuss why you had a poor care experience, okay? But this is after, number 1, you make sure that your medical needs are addressed. So 3 tips to deal with it. Sorry, I'm tired, red eyes, tired, but I'm here. I want to share this with you because I've had a lot of complaints in the last 2 weeks. And like I said, it does everything inside me to just, listen and help to give advice without giving other comments. So number 1, make sure your medical needs are met. Welcome to the broadcast. Welcome to the broadcast. Number 2, you have the right to talk to a patient advocate or an ombudsman, depending on the system. You can find that out from either a floor nurse supervisor if it's an inpatient poor care experience, or anyone at the front desk, or ask to speak to a manager at the hospital, and they can provide you with that information. All right, and number 3, when you find yourself in a poor care experience, this is Dr. Melva. Thank you so much for joining the live broadcast. If you're catching me on the replay, 3 tips with dealing with the poor care experience. Number 3 is talk to a physician or healthcare practitioner that you trust, okay? So depending on where the poor care experience was, the interaction, whether it was with your medical oncologist, your radiation oncologist, your primary care physician, at an urgent care, an emergency room visit, talk to a physician that you trust and let them know about what happened, okay? So when you talk to a physician that you trust, for example, the patients and family that came to me, I'm able to offer suggestions. I'm able to help with coordination and communication. I'm able to speak to the physician or whoever was involved in that transaction to understand how we can prevent you or any other patient from having problems in the future. I'm able to direct and guide you or my manager and staff to the patient advisors, okay? So 3 tips. And sorry this is fast, but it's been a long day. It's a long day. It's been a long week, and I feel like I say that every week, but it's a lot of things that as an oncologist I do behind the scenes. a lot of coordination of care, which I'm super passionate about, compassionate care, even if that means that for 2 hours solid, I'm listening to what's happening. I'm listening. I can't always respond right away because we work in very small circles, and we have to make sure that we address things. Thank you for that. Thank you for that. We have to make sure that we address things in a very professional manner. Tip number one, make sure that your medical needs are met, okay? Don't get to the point where you or a family member just blow off all the smoke and tell them exactly where they can go at the visit. Just hold off. Just hold off. Recognize that you are in a poor care experience and know that you will have more impact if your medical needs are met and we address this in the right form, okay? You're going to have more impact for you, your family member, and anyone else that's been diagnosed with cancer and finds themselves in a situation that's just unacceptable, okay? So number one, make sure your medical needs are met. Number two, talk to and report with a patient advocate. Every single hospital system, hello and welcome to the broadcast, thanks for joining. Every hospital system and outpatient clinic has a patient representative, a patient advocate, an ombudsman, where you can discuss discrepancies, concerns about your care, okay? And then number three, get a second opinion, talk to a physician that you trust. So if your situation was in urgent care or emergency room with your primary care doctor, medical oncologist, radiation oncologist, talk to one of those physicians that you trust. So, for example, when patients come to me, I'm not a medical oncologist, okay? I do not administer chemotherapy or immunotherapy. I'm a radiation oncologist. I administer radiation in different forms, okay? But I communicate, I collaborate, I coordinate with other physicians. So it's very easy for me to pick up the phone and ask, do you know about this situation? You know, openly, without blame, to talk about it and say, hey, my patient came in today and they were quite upset and they said, you know, this is what's going on. Can you tell me a little bit about what's going on? Can you tell me a little bit about, okay, I think it's messing up. So I was saying that as a physician, a radiation oncologist, I'm not a medical oncologist. But for example, if patients come to me with a medical oncology or a complaint that has something to do with another treatment they're receiving, I'm able to coordinate, collaborate, and communicate with the other physicians. I can do that. And if a patient is continuously, something that happens a lot with patients with cancer, after they have a course of treatment, you can have side effects, right? And it's easiest to send you to the emergency room. Sometimes you need to be direct admitted to the hospital, either to observation or as an inpatient. One, because your blood counts can be low, and two, because you're under special treatment. You have specialists like myself or other oncologists taking care of you, which deserves extra attention, okay? Welcome to the broadcast. Thanks for joining. This is Dr. Melva. We're talking about 3 tips, wrapping it up, for how to deal with a poor care experience. I'm very passionate about this, so if I'm speaking fast, I hope you can understand me. But this is very near and dear to my heart. Thank you for that. So what I was saying is that as a radiation oncologist, I'm an oncologist, and I can help to coordinate care even if I can't treat you for that problem. So like I tell my patients or patient and families that I do consulting work with, you're able to find a physician that you trust who will advocate on your behalf, okay? Thank you for the love. Thank you for the love. I advocate for my patients. So like I tell different patients, and to keep it all HIPAA compliant, if you find that you're not getting the care that you need, find a physician that you can trust that will go to bat, get on the phone for you, and figure out how to, 1, meet your medical needs, 2, get your issue to a patient advisor, and 3, assure that your care is coordinated, collaborative, multidisciplinary effort, and that you and your family are treated with the respect that you deserve. All right. Okay, I'm off my high horse there. I hope this was helpful. Like I said, I've been going all day. It has been like a long week. My eyes are red. I have nothing to hide. I don't have any drops to put in them. I'm still in the office because even though it's the end of the month and the hospital administrators want to see those notes because it's a new month tomorrow, I have to put things in that aren't billed for, okay? This is about compassionate care. So I'm here. Woo! I'm sorry, it's been so long, my eyes are burning, but I'm here to share. Thank you so much for joining the live broadcast. We talked about 3 tips for dealing with poor care experiences. I'm Dr. Melva. Let's see the comments. Let me know if you have any questions. If you got value out of this, please share. Sharing is caring. All right, Dawn says hello. Michelle Stewart says hello from North Carolina. Hi, Michelle. I'm broadcasting live from North Carolina today. Dr. Lakeisha says hello. Hello, Dr. Lakeisha. And let's see, is it Shauna? Am I pronouncing your name right? Welcome to the broadcast. I agree. I'm a nurse manager in a nursing home, so these tips are awesome. Oh, thanks so much for that, Shauna. Yes, I can imagine in a nursing home there may be some experiences where this could help out. See, I like to keep things good. Any questions for me? Any questions for me? Again, if you're just joining, I'm Dr. Melva, and I help patients that have been diagnosed with cancer navigate the cancer care system, coordinate care, and live life in spite of cancer through my videos, speaking, and community cancer centers. You can find me right here on facebook.com/Dr. DOCTOR Melva, MELVA. Thank you so much for the love. Yes, I pronounced your name right. Okay, yes, Shauna, thank you so much for joining. Are there any questions before we wrap it up? I'm going to head home and see the little ones. It's been a day. But I did get my notes in before the end of the month. Shout out to my billers. All right. If there aren't any other questions, thank you so much for joining. Again, we talked about 3 tips to help with the poor care experience. I'm Dr. Melva, and you can find me right here on facebook.com/Dr. DOCTOR Melva, MELVA. Thanks so much for joining the live broadcast. Bye.